Thank you. All right, so you all had some questions on your agenda, but also just thinking about any questions about the data that you've seen, and then we'll go into the discussion
Yeah, I was
questions.
going to say, let's do the data questions first.
Okay.
With maybe you and Dan, and then we can get into that, because I'm sure there's questions about the data.
All right.
I just have a clarifying question. You cited a statistic about folks who wanted to move,
Mm-hmm.
who would leave permanently. Can you clarify, was that move away from their neighborhood? And how many folks would move to another neighborhood in Detroit versus move to the area? I didn't quite catch if that was both and or.
So we had an overall question of those who want to move, yes or no. So we asked them about if you had the opportunity in the next 12 months, would you want to move? And then we asked those who said yes, where they would want to move. So we have both. And I think, yes. So I think it was on this slide, but we do have a distribution. I don't know why I don't. We do have the distribution, yes, about where people want to move. So we know that 43% of city residents, that's the overall number, but those who want to move, 46% would want to move somewhere else in the city of Detroit or the Detroit suburbs.
I guess I just think that's a really important distinction
Mm-hmm.
to me. Like, how many people are wanting to move? Oh, wow, this is such service. How many would want to move within the city versus how many are saying, I want to leave the city completely? So doesn't have to be answered right now, but
I think it's
just
about
think
a
that's
third. I think
important.
it's about 33%. Telly, you could fact check me if I'm wrong. I think that number is about a third that said it was like some other area in the city.
Yeah, I think it was a slide before.
Did I miss it?
Yeah, we have to make that. The
Yeah.
question is move away from your current area.
Yeah.
So it could be basically to a different neighborhood in the city, or it could be to the suburbs. And then we looked at what percentage is saying move away in another area but within the city, and who's saying move away to another area but outside the city limits.
And I should have said at the beginning, this is so exciting. Thank you so
No,
much
no,
for
no.
putting this together.
I get geeky about this, don't worry.
Okay. I was just curious if you looked at mobility cross-tab with the life evaluation scores. So are people who are more satisfied less likely to want to be moving?
Correct, yes. So those who are in that thriving bucket, so we see those Detroiters who are thriving are also less likely to say that they would like to move permanently somewhere else. Yes. We have Anika and Angelica, but who do you want to go? Do you?
Okay. Hi, Camille. Thank you. Can you remind us, or me, if others remember, how many people were involved in this survey and your methodology? I know that you sent it out through paper, but can you just sort of remind us of that, like, top line?
Sure.
The numbers
Absolutely.
and the approach.
Thank you for also making sure I get this little softball. I should have started with that. So we almost had close to 12,000 completes in terms of residents. We send out almost 150,000 survey packets to residents that are living in Detroit and the surrounding counties. So essentially, when we look at the numbers across the population numbers, it's about 1 in every 10 households got a packet with a survey from Gallup. So, and then we had almost a little under 12,000 respondents to send back their surveys. Individuals could either fill out their paper survey and mail it back in a self-addressed business supply envelope, or there was a unique QR code on that invite that they could also take this by web.
And I would just comment on that the decision to go with that survey design is important for a couple of reasons. One is, as opposed to doing like an online method, we're making sure that we're reaching every household. Everyone has the same probability of being included in the study, so that we can say these numbers, we're confident this really represents the overall city. When we talk about these subgroups, we know that they're representative, and we've got really good confidence in it. The other reason it's important is, other
Camille, I just wanted to confirm the region is Wayne, Oakland, Macomb. It's not
Yes.
like Washtenaw, Livingston. It's not the MSA. It's just the Tri-County. So just for
Perfect.
everyone's
Thank
reference.
you so much, Christian.
Can I get an update on the question about moving within the city or the suburbs? So we have 13% of those who say they do want to move. 13% are saying, I want to move but stay within the city. And then we have 33% who say to the suburbs. 18% somewhere else in the state of Michigan, and 30% to another state, and then about 6% to another country.
Do you have, because you have, it looks like you did some neighborhood mapping, do you have the methodology by mapping, by geography as well?
Yes, what do you mean? So if we have where each respondent location? Yes,
exactly.
yes. I think we have a map of it that shows,
The last slide.
and some of you all, if you saw the Mackinac where we mapped it on thriving, and it's coming up. This. So each dot represent every respondent that responded to the survey. The household, yeah.
So of the 12,000 surveyed, were they equal to Metro Detroit and then equal, the portion of them equal to just Detroit? Like what percentage? Was it evenly distributed or was there a larger percentage that went to Detroit?
A larger percentage went to the city because we disproportionately oversampled young black Detroiters, so young black residents living in the city, because when we got halfway through, we saw that, response rate lagged a little bit for that age group. And so we went back in with a second round that oversampled young residents between 18 and 34 living in the city, and we did a similar oversample because we want to make sure we have comparable data for those that are in that Tri-County area, so we do that. But majority of the respondents came from the city because we oversampled for Detroiters living in the city.
I'm gonna come stand by Camille so that people in the back of the room hear my comment on this. Also just because I really like her. But while this map is up, I did want to point out, so we've broken the data up into neighborhoods based on official neighborhood mapping. But when you see all the actual points on the screen, this is another thing that I think is exciting when we think about where we can go with this, is we can bucket those respondents however we want. And so if you have specific areas that you're focusing on, an economic development corridor, or you want to lump a couple of neighborhoods together, or we want to start thinking about looking at things like proximity to different resources. So one example would be like, how far does somebody live from mass transit? Mm-hmm. There's so many ways we can cut this. We haven't gotten into that yet, but because we've done it in this way, that is something, that potential exists for us as we think about year 2 and additional analysis with this data.
So I have a question about your key determinants of well-being. Did you consider access to like food and basic goods and services? Is that collapsed in one of these, or
Yes.
was it just left out?
So it was collapsed in our community and environment measures. So those measures that might get to it quicker. Yes. So when we think about just the satisfaction with neighborhood services and conditions, so that includes both the aesthetic, actual services like fire and snow removal and lack of blight, but also access to cultural opportunities, access to recreational areas, access to stores with fresh fruits and vegetables, and also safety. So feeling safe walking alone at night in your area. Okay, we have one behind, and then we'll get to you, Stephanie.
Okay, this is not a data clarification question, but it is about the scope. So I'm curious, what about data or discussion about disparity or perception of it? And part of the reason I'm asking is there was a report released last fall by PolicyLink that went into occupational segregation and other factors of disparity in the Detroit region. And it showed that the median hourly wage for white workers in Detroit with a high school diploma was 12% higher than black Detroiters with a associate's degree. And there were a lot of other data points that map similarly. So it just got me wondering if there's something that we're missing in not looking more at disparity as opposed to just how people of color are faring.
So let me make sure I understand the question. So I think when Dan talked about, so some of those transactional data, so for instance, median income or range, I think that those are things that we can plug into and append the self-reported data. So one of the things that we wanted for this data to do is to be complementary to those hard data, right? So what is it about? So we do know that, okay, so we know that that disparity exists in earning, for instance, or wage. Well, how does that manifest itself in Detroiters' everyday life? Well, we see some of the things is that, for instance, let's just look at race on something like worrying about money in the last 7 days. So we do see that one way that that's probably manifesting in Black Detroiters' life is that Black Detroiters are significantly more likely to say that they've worried about money in the last 7 days, right? So that's kind of what I would say is an experiential manifestation of that disparity that we probably see in how much people are earning, right? So that was one way that we were saying we could partner those two data to say, okay, we know this disparity exists in this outcome of wage and income. How is it showing up in people's everyday lives? Well, it shows up in ways of who's able to say, I feel financially secure, or my perception of I can get ahead by working hard, right? So let's look, if we pair those two data points together by wage, for instance, which is an outcome, do we see that people who are making less are also more likely to think that they don't have the opportunity to get ahead by working hard? And what we know about that from these data is that those people are also less likely to be thriving in their overall well-being.
We also know another example of a disparity that may be related is that we know that Black residents are, an overwhelming majority of Black residents are reporting that they do want to start a business, but they're also much more likely than white residents to report that they do not have the resources to start a business. So we showed that, we showed those numbers.
I really appreciate that. I just, part of why I'm bringing it forward is it seems like part of the goal of this information is to guide policy and action. And so the more that I think we can layer in the conversation about disparity, the more relevant our actions will be.
Absolutely, 100% agree. So we have Stephanie and then Marnita. It looks like you have, I'm going to look to Marnita to.
Okay, so I have Rodney, then I have Stephanie, then I have Dr. Hudson.
Okay.
Quick question. I think I heard the respondent's length of time as a city resident referenced earlier, at least related to one of the questions. I'm just curious if that is something that was looked at across all the questions, and if you saw anything in the data as it relates to the length of time that the respondent has been a city resident.
Yes, so we did it, and we picked this one as the most important. No, we did look at the data, and primarily just for the deep dive. So we are able to look at every question based on length of time living in the city, and so we also can look at who's thriving, right? And what we see is that the longer you live in the city, the higher percent of those folks that are thriving, which is in line to kind of some of what we know about the overall measure about thriving, that older adults tend to more likely to be thriving. We see that trend holding up for city residents. So the longer you live in the city, you would assume that you've also been living longer. And so we have been able to, one of the things that we're highlighting here related to just the number of years living in the city is we looked at it just in the context of this question right now for the that you're seeing on the slide on those who are likely to move permanently. And what we see is that the longer you're living in the city, the less likely, the less of a desire you have. Right? Yeah. Yeah.
The other, I would just add one comment on both of the last questions. This, we're still, this is I think the fourth or fifth time we've presented different versions of this data, and we're still just scratching the surface of what we have available. And so this is an example of something for you all to be sharing with us. If there are specific priority populations, or there's intersections of different demographic variables, or things like we want to focus on long-term city residents that meet certain characteristics, we have a lot of survey respondents here, and so we can do those sorts of analyses and come back, or look at data where we're looking at the full distribution and what's the shape of the distribution of data. Do we see that there's more inequality within a particular question? All of those sorts of questions are things that we would love to get into and make sure that as we move forward with this project, we're getting you exactly the data you need for your priority populations and for the questions you're trying to answer.
Thank you.
So I just had a quick question. how long was this survey and when exactly did it take place? What's the timeline?
Sure. So the survey was 8 pages long, and we fielded fall of 2022 to the winter of 2023.
Can I go now? Oh, okay. Hi. So my question was around how you disaggregated the data based on gender, and specifically what I was interested in was the quality healthcare questions and the well-being. Just knowing that we have pretty much the worst rates, not even in the country, but around the world for Black maternal mortality and infant mortality. And I didn't know how that showed up here, but I was surprised that it wasn't more glaring in terms of what people are experiencing here, knowing the battle we're having right now with that issue.
Tully, you want to talk about the gender?
Yeah, so in the models that we ran, if I remember correctly, and I can check just now, but I don't think gender was a significant factor that emerged in the models. Basically, we did not see that men and women reported different levels, statistically significant different levels of well-being. And I can check that again. But something else that the models did, we controlled for all the demographic factors. So basically controlling for things like gender, race, age. What are some actionable characteristics that contribute to people's well-being, right? So such as satisfaction with aesthetics and services in the neighborhood. So we looked at those more actionable correlates, controlling for the demographic variables.
Was the question asked about whether they were single female-headed households, or anything around marital status? Or
Marital status, yes.
Yeah, we do have the ability to, so if you wanted to say, well, let's kind of like isolate with this group and look at it among women who live in the city who have these characteristics, we do have that ability to do that. But I think to just also, I would say refine what the point in the model for the thriving and those determinants, it's not that it's not important, but when we say controlling for all things like this, what are those determinants? We don't want to call them driver because then I'm gonna get in trouble with Telly. The determinants for whether or not you're thriving, it's not that it wasn't important, but the determinants that we showed were bigger predictors rather than what your gender identified as male, female. So that's not that there weren't differences, but when we start to think about what was driving how you were rating your life, right? That once we started to control for gender, we didn't see that much of a determining factor related to that. Hold on.
Can I make a comment?
No? Yes.
So some data that I've seen of Camille's work is that Black men and women experience discrimination equally in cafes, healthcare, and that kind of thing. Not in the workplace. And so there's a delta between men and women. Men have a pretty good time in the workplace. Our first national day, national day is probably here. But women, so we say we achieve 100%, something like 100% respect all day at work. Women are significantly less likely to are significantly more likely to report not being respected in the workplace. That's one place you can find it.
Women or black?
Black women
I was
are,
doing all black.
Yeah.
I was doing all black. Black men, black women. All of them.
all right. Marnita, we,
I don't want to go back. I disagree with that. I'm sorry.
So,
I can't see how that's possible.
what do you, just the,
I know plenty of Black men who don't have that type of experience at work. So I'm just trying to, is that for the whole country or?
That was the whole country.
that was the whole country. So what we look at, when we look at it across the intersection of race and gender, we see that Black women were least likely to report, at work I'm treated with respect. Black men's scores on that item were very similar to white men. So the disparity between who feels respected at work, there was a larger disparity among Black women. And when we compare Black women to white women and Hispanic women, Black women were the lowest. When we compare, Black women were the lowest overall across gender, across race, and ethnicity. Okay.
So one question, maybe you could answer, and it might get to what you're describing. I'm having a little trouble distinguishing between the kind of ACS and other standardized data that a lot of what we're using that might tell us a different story, as opposed to the kind of survey data you're receiving. So that's one that I'd like for you to elaborate on generally. Because I think that'll help us think about how to narrate this in the public. The second question is, the percentage rate still seems really low, the respondent rate. And so how is that normal for all of your panel surveys? Just because when we've done other panel surveys locally, we've gotten a higher response. And we know that this is probably the most challenging form of survey. And so if you could answer those two.
Sure.
I'd take the second one first and get that one out of the way. So we're not using our panel, so that's one thing. So if we do a survey with a panel where we already have respondents, we expect more like a 25%, 30% response rate. For a community survey where we're mailing out the packets like this, 10% it's what we budget for. We assume we're gonna hit 10%. In a community that has really high engagement rates or the program's really well known, maybe we get up into the teens, but this is not atypical for an overall response rate.
Correct. And then the other question was, how do you contextualize these data with the other data? I think one of the ways I'd put it is, most of the other data is probably around those outcomes, right? So I think there was a question about just what we see in terms of the disparity. This is more experiential, right? So the way we ask the questions and the questions that we're interested in asking is less so much about counting whether you have this or don't have this. I mean, we have some of those questions, we consider those demos, but it's more around what your everyday experience is like. So if you think about the question to say, we know your income, but we also have a question other than how much money you make, and that's a number probably, once we put up those statistics, would be very similar to what you see in terms of the ACS data. But we ask you, well, how do you feel about your present income? Would you say that you feel comfortable, you feel like you're living comfortable on your present income? Are you struggling on your present income? I think that's that experiential context that will partner well with something like household income. Well, okay, so even if you say Detroiters' median household income, which it isn't, is very typical to what we see nationally, but you're saying even if it is, Detroiters are significantly more likely to say that they are struggling to get by on their present income when we compare that measure on a national level from the center. So, right, it's really kind of saying, what do we know about these hard transactional statistics, and how it manifests itself in what people are telling us about their everyday experiences, right? So you can say, I make $120,000 a year, but those individuals are also less likely to say that they are more likely to say in Detroit that they're worrying about paying rent, or they are having problems finding affordable housing. But that would be very different probably if we were to measure it somewhere else and look at individuals who have that income. So something like that is to say, how do we partner our survey data around everyday life experiences and what we know about these other outcome variables that we tend to have a lot of data and track regularly. Hope that answers your question.
The other, if I could add one piece to that as well, I think I think a lot about health behavior research, and so do a lot of work in the public health space in particular. And so if you take an outcome metric like maternal mortality rates, right? We know we've got to fix that. What do we do to fix that, right? And there's lots of, within the health system, people are looking at, you know, what may be going on, what diagnoses are happening or not happening, and looking at a lot of the things that you could track easily by just counting outcomes or counting procedures or counting complications and things like that. But what those miss is things like trust in the healthcare system, confidence in doctors, the self-efficacy around following doctors' advice, whether or not they think they have the ability to practice healthy behaviors, right? And so what we're doing with this survey data, and you could take this for the economic measures as well, job outcomes or educational attainment, is we're working upstream from those outcome measures and hopefully identifying those points of intervention where you can come in and say, I know I have this issue with this outcome measure, what do I need to do? Well, maybe I need to focus on educating people about resources that are available, or I need to focus on developing certain sorts of skills and I'm giving hypothetical examples now, but that idea of the subjective data, the self-reported data, is how we get upstream from those outcomes so that we can actually make change where it matters for people instead of waiting for the outcome.
And I'm going to take that softball, Dan, because you mentioned health and experiences. So what we see on the national data, for instance, with health experiences and trust, is who's more likely to say that they've had an experience within the last 3 years with discrimination. And discrimination as measured as somebody didn't listen to what you were saying or didn't think you were telling the truth about how you were feeling. And what we see is that 25% of black women are significant, which is a significantly more likelihood of saying that they'd had one of these experiences in the last 3 years, and how that kind of plays into those outcomes that Dan just mentioned. So that's something that we're also tracking nationally, right, is people's experiences with discrimination while receiving care. How does that show up in terms of those outcomes? You just gave me that softball, and I had to drop that stuff. All right.
All right, good afternoon. I had a question about the data that was lifted around discrimination and the difference between black men and women reporting. And I was wondering, did you all take also the lens applied to that data that determines how minoritized populations respond to surveys, particularly job satisfaction, and how they rate themselves even in doing a job, a well-done job? So I just wondered if, understanding that, are we also applying like that equity mindset and lens and thinking and considering about how black men and black women respond to surveys within the workplace?
I love that question, because when we saw that finding, it was astonishing, right, that there was that this disparity just between what we saw. And first, we asked surveys, so these weren't employer surveys. So because the national study that we do, we ask anybody. We don't ask you where you work. So there's kind of a little bit of kind of making sure that people don't feel like, you know, we're watching them for their employer versus like an employer-led employee survey that might ask that question, which we do at Gallup all the time for our, you know, employee engagement surveys and culture audit surveys, right? So we'd ask that question at work, I'm treated with respect. But on the national study, so it's not an employer survey, so it's kind of outside of the context of we don't know where you work or who you work for on those surveys. So to the point of when we saw that, for me, it was like, wow, it was very counterintuitive to probably what I would have perceived that would be. And in some qualitative conversation, it was, so what is it? Why do we see that? And I think that there's some explanation that I've heard around this aspect of, you probably can discriminate against me. This is from black male, don't have that lived experience, but it's like, but what you will not do is disrespect me, right? And how that is contextualized and interpreted when we ask that question to say, at work I'm treated with respect. It says, you might discriminate against me, but what you will not do is disrespect me. I did not understand that dynamic and that context in the way the question is asked and around the word and the use of the word respect. So that was one kind of qualitative feedback around the question and the finding when we did some follow-up.
Yeah, so I also want to.
Yeah, I had just a question, as far as, especially because you drew that distinction between discrimination and disrespect.
Mm-hmm.
I think a lot of times it's because it is believed that the discrimination is inherently a part of the system for which I'm participating. So the discrimination is par for the course, but the expression that there's discrimination in the form of disrespect is what I think that we may be missing there. Because the belief is, as a black man in that system, that inherently the system is discriminatory.
I wanted to mention one other example from our national studies on this is we asked people about their career aspirations. And so, you know, we have to simplify this in order to do it, but, you know, saying, you know, do you want to be a CEO someday? Do you want to be a manager someday? And we asked this across a representative sample of the workforce. And again, and when we looked at the intersectionality of gender and race and what people's aspirations were, we see some different patterns. We see, you know, mostly men are slightly more likely to have these sort of senior level aspirations in their career, but it's a small gap. It's not a significant gap. But then when we looked at asking a follow-up question of how likely do you think you will be able to achieve that goal, we saw this really big gap start to open up. And so you see a gap by race start to emerge, but then also a gap by gender emerging. And so people having similar aspirations, but not necessarily believing that they're going to be able to get there. And I just mentioned that as an example of, I think it can be really hard to get in and measure stereotype threat or these kinds of concepts we're talking about here. What does discrimination mean for this individual? And one of the things we're interested in is what are other ways we can try and cut at that data and come at that from a different angle. So I think there's probably other interesting examples like that we could come up with, but wanted to throw that one out there.
So I also want to express gratitude for this, and I appreciate the kind of very city focus, and I'm very excited about the ability to get down at a more granular neighborhood level. But in the back of my mind, I'm also wondering, how does Detroit compare with the region? How does Detroit compare with the U.S. more generally from your data? Any kind of headlines that you're finding in terms of stark differences in those questions?
Okay, all right, Peter, you're going to cause me to pull back, see how much I can recall. So I know we shared the thriving, but one of the things that we know in terms of some of the key areas around satisfaction with, for instance, school, satisfaction with the availability of affordable housing, that we do know that Detroit residents lag significantly behind the national numbers that we see among Black Americans, but also the U.S. population. So there are particular areas around aspects of life that we do see Detroiters lagging behind our national measures. And particularly the two that comes top of mind is how they rate their satisfaction with the quality of the education system and the affordability, availability of affordable housing. All right.
Hi, thank you for this. One of your questions was, how do you overlay your work with other ongoing work locally? And I just wanted to lift up the University of Michigan's Detroit Metro Area's Community Survey. It's 2,000 representative residents of Detroit who really are a very valid group and statistically, and are asked a lot of questions about their experiences. So I think there's a real sweet spot in how that survey works to combine experiences with sort of emerging outcomes. And so I would just really encourage you to work closely with the expertise there. They have a different approach. They're social workers. You know, they don't get featured at big conferences, but they are really steady and they are great at partnering.
Absolutely, love that idea, thank you. And I think we met in some of the design with Elizabeth.
Incredible presentation, thank you so much. Curious about the fact that this is also about experience. You talked about aspirations and attitudes. You mentioned the American dream. I'm curious, two kind of data points that stood out in that context related to youth is the perception around not being able to get ahead with hard work, and then also youth who want to move out of state. Did you see kind of perceptions around people believing in a dream, the ability to reach goals, hope, and kids wanting to move out?
So I think I know we could look at it specifically for 18 to 34-year-old Telly, but we know directionally for those that don't perceive that they have the ability to get ahead by working hard, much more likely to say that they would move if given the opportunity. So we do know that directionally that's there. We'd have to see this, to what extent do we see the differences by age, but that should be interesting to see. Yeah.
So we don't have the analysis on hand. We did see the example of youth being less likely to be satisfied with education in the area. But the thing I wanted to call out, so Camille talked about this slide, and we said the number one reason to move is crime, right? Mm-hmm. The rest of them are hope, is what I see when I look at this, right? Is the rest of them are a better place for my children, opportunities, education, cost of living. I can't live the lifestyle I want to live in this area where I live. And so, crime will chase people away, but all the other ones are things that they say, I can get something better somewhere else. And that's definitely something when we look at these questions that youth are definitely going to look different on. So, answer that question. Yeah.
The best definition of the great American dream is still to have a good job.
Okay.
Now, it's not everybody, but that's the biggest. If I had a pie graph, that's the biggest one. There's a little caveat on that, with a living wage. And that's why unemployment is such a misleading number, because you got 60% of America that's broke. Okay, but to your other point, what you really want to fill a person's body with, especially young people, is hope. If you could just pick one thing, fill that body with hope. And almost everything gets better. But that's why the best question to follow is thriving. Because remember, the question is, on a scale of 0 to 10, with 0 being the worst life imaginable. So I got the worst life I can imagine. That's what I have. 10 is the best life imaginable, where I don't envy anybody. The money question, so let's say I'm a 7. Ashley's a 7 also. The money question is, where will you be on that same scale in 5 years? Ourselves, academics, 2 Nobel Prize winners, they all think we found hope in that question. Mathematically describe hope. Because she says I'll be a 9, and old Jim says you'll be a 3. You found hope in her, in that delta. And we say, well, why are you so happy? Well, she's starting a motorcycle shop and renting things, and she's going to have a bunch of money, and she's hiring her sister and a whole bunch of things. And me, I don't have the skills to get a job at it. You see what it is? But we think if you want to know how much hope there is, you got the American dream. That's always the same thing. Job, living wage. It's not as much about owning a house anymore for the people in real estate. You know, the young people would rather spend their money to go to Cabo or somewhere like that rather than buy a house. They get married 15 years later. They have half as many kids. They're truly very, very different. But you still want to have, but hope works, and getting them a good job with a living wage works.
All right. So we have maybe 2 more questions before we go to wrap up this.
Thank you. Camille, I just think that this is fascinating information. My question for you is, based on the information and maybe the statistical sample size that you have, do you feel like you have enough comparative data that represents enough of the census tract, right, where you can truly use it and to say this is the majority of the voices and we need policy change based on this? Do you feel like you have enough of a sample size to really impact change?
I would say yes, and here's why. The fact that we, our statistician tells us, if you could say, was there an opportunity where 1 out of every 10 households had an opportunity to participate in the study? But also, the fact that we are weighting this data back and the volume of responses that we have at 12,000, I think being able to not just look at that overall level, but to be able to also weight that and represent it at the intersections of race and age, the intersection of race and gender, I think it's very much representative. I think it's a robust data set that is allowing us the ability to really look at disparities or differences in people's experiences across a number of important items and elements, where when we started this survey, we say it would be important to see how Detroiters are doing on this, but to also understand what or who isn't doing well on what, and I think that this answers that question. The statisticians will tell you it's weighted to be representative. When we cut the data by those major buckets, it still remains representative, and I think it's the robust nature in which we have over 12,000 respondents. This is a very large study of this type, so when you think about studies that you've seen, and having the ability to, the deeper you go, you're going to lose representativeness, or you're going to lose that analytical power. The fact that we have 12,000, we can go deeper and still say these are stable estimates that we have weighted, and that's representative.
All right. I think, listen, we want to be really respectful of the time, and I know we've already lost a handful of people. First of all, Camille and Dan, thank you so much for coming and doing this. So here's what I'm going to do a little bit of an audible here, and hopefully this will work for everybody. Again, we want to be really respectful of the time, so we're not going anywhere, but we want to allow those who need to depart for their next appointment go ahead and do that. I want to summarize and maybe talk a little bit about next steps right now. So first of all, just kind of a reminder. I mean, this has been a really rich discussion, and I just want to remind everyone as you kind of walk away from here, and as you take your packet, which I assume is on the other side of this wall, with all the slides. This was always meant to be a companion research piece, data piece, to existing data and particularly existing data organizations already in the region. When Gallup did their work in creating the Detroit-specific survey, they worked with all of the members of the Blueprint Group plus all of their partners, and I think we had, what, 50, 60 different, entities from the area, including the University of Michigan Poverty Solutions Center, the University of Michigan, the one that you mentioned, all part of that inputting into this. So it was a very broad, broad input pool. The second thing I want to say is this is year one, volley one. And our whole goal was to get this survey in the field with all of the input that we had, with all the partners that we had, and learn from it and then figure out where to go from here. Where do we need to go deeper? Where are the interests that didn't get covered? And are there specific areas or interests that that organizations, either philanthropy or service organizations or data organizations or companies for that matter, want to go deeper, and then let's figure out how we do that and how we price for that and how we at the Detroit Regional Chamber go out and raise the money for that so we can continue to do this work. So we have, obviously a follow-up conversation that we all need to have about kind of what's next steps. There's a lot of, we call this a deep dive. There's way deeper to go here, and so what we want to work on now is make sure that all of the information that that Gallup has already pulled becomes broadly available. Right? This is not proprietary information. It's not for Gallup. It's not for the Detroit Regional Chamber. It's for the entire community. It's for anybody who wants it. So we want to work with you to make sure that it is easily accessible. The second thing we want to do is we want to make sure that all of the great data organizations that are out there, and many of you are in this room, including the Chamber, we've got a tremendous data team. How do we make sure that all of the data that impacts our city and our region are kind of equally and easily available, so you can look at some of the hard data coming from this organization coupled with the well-being data coming from Gallup, and we kind of mix and match, and you can kind of create your own. We also want to we want to get to the point where we've got the resources to be able to put this on a site that we all share, and it allows people to kind of create really easy customizable data sets for your organization, for your business, for your community group, whatever it is. Obviously, we're not there yet. We've got to figure out how to do that. Kristen's Lucas in the back, who's our director of research, is sitting in the back. He's like going, I can't do that right now. But hopefully we'll get the resources to be able to do that. So, and then finally, what I think all of our ultimate goal is the understanding that data is data. Data really doesn't matter unless we're able to do something with it and track it. And so what we're really hoping that this is a catalyst for collective action. So we want to continue this conversation with this group about how do we make this more into collective action as opposed to, oh, this is really interesting data. So if this is just really interesting data, we have not done our job. So I'm going to kind of formally break this portion of the program now. Feel free to stick around a bit, talk to the folks from Gallup, talk amongst yourselves, and then we'll figure out kind of maybe via Zoom to kind of convene this group again. So thank you all for coming. Thanks again to our friends from Gallup. Have a great rest of your day.